away.
Hi, I'm Cindy. I'm going to be your nurse practitioner student today. Today I'm going to be doing a head-to-toe physical assessment on you. If you have any pain or discomfort, please let me know. So initially I'm going to be looking at your overall well-being and seeing if you're having any mental health concerns. You look like you're in no apparent distress. During this exam, I'm going to be examining your skin throughout, looking for moisture. I'm looking at the color, texture, looking for any lesions. Looking at your hair distribution pattern, any scars, and your trigger. So the first thing I'm going to have you do is place your hands out like this. I'm going to be assessing your fingers. Let me know if anything hurts here. Not seeing any bony abnormalities of your hands. Next, I'm going to assess your capillary refill, and that's brisk at less than 3 seconds. Down, if you can put your fingers like this. I'm going to be looking for clubbing. I see the little window, so negative for clubbing. Next, the thing that I'm going to do is I'm going to check your radial pulses. Here I'm throughout the exam, I'm going to be checking for rate, rhythm, amplitude, and symmetry when applicable. So heart rate is at 72. The pulses are symmetrical, 2+ out of 4 for amplitude, and regular. I'm going to go ahead and have you grip my fingers here and just pull against me. Good. So strength, 5 out of 5. And next, I'm going to be assessing your wrist joints. Any pain there? Nope. So going to go up the arm, feeling for any bony abnormalities, any pain at the olecranon, going up to the glenohumeral joint. Any pain?
Nope.
All right, going to go all the way up to that olecranon on this side, doing the same thing, just feeling for any abnormalities, any pain in the shoulder? No. All right, so no abnormalities noted in the upper extremities. All right, so next what I need to do is we're going to do some shoulder and some wrist range of motion exercises. First, I'm going to have you just follow me, so hands out like this, and then I'm going to have you flex your flex, good, and then extend out. I'm going to have you pronate and supinate, good. Then I'm going to go ahead and have you bring your arms all the way across, so we're looking for adduction, all the way back for abduction, good. Then I'm going to go ahead and have you do some internal rotation, which is behind the back, looking up how high your arms go, good. And then we're going to do some external rotation. Yes, external rotation. Good, so full range of motion of the shoulders. Now we're going to do some strength. So I'm going to have you just hold your hands out like this. Go ahead and resist against me. Good, 5 out of 5. Push against me. Good, strong. 5 out of 5 there. You're going to do deltoid strength. Push against me. Good, 5 out of 5 on deltoid. Now we're going to be looking at your hair, looking at hair distribution pattern, looking for any infestations. None noted, no rashes. Now we're going to go on to your eyes. With the eyes, I'm assessing for any lid lag. I'm looking for edema and exophthalmos, which none of those I see. Do you wear contacts or glasses? Glasses, okay. So the next thing we're going to be doing is I'm going to be doing a couple different tests to test your eyes. So the first thing I'm going to have you do is watch my finger. This is going to test for ocular motor 3, 4, and 6. Have you follow my finger. Good, looking for any nystagmus, and good, coming back, all the way up, coming all the way down, good, no nystagmus noted in 3, which is ocular motor, 4, trochlear, 6, which is abducis. Now I am going to go ahead and look at the sclera and the conjunctiva of your eye. Go ahead and look up for me, and side to side, good, and down. We're going to do the same thing on the other side. Good, up, side to side, and down. So the conjunctiva is clear, the sclera is white. And now I'm going to do some pupillary response to the light. So this is this is the cranial nerve 2, optic, and then cranial nerve 3, ocular motor. Looking for direct response, which is good there. Good response on that side. Now I'm looking for consensual. good consensual response and direct response intact. Now I am going to do convergence. I'm going to have you look at the pin and then look all the way out to the wall, back at the pin, and back out. Good. So your pupils were dilated for far vision and constricted for near vision, which indicates that convergence is intact. Okay. Now I am going to go ahead and I am going to do the fundoscopic exam. So this is going to have a bright light shining in your eye for this part of the exam. I'm going to have you look out straight ahead of the wall. Here I am going to be looking for the red reflex, which I see coming in. Good. Looking at all four sides of the eye. Good. Keep on looking out straight. Going to go ahead and come on in, looking for that red reflex, which I see. Good. You're looking at all four corners. Good. So with that, I was able to visualize the optic disc, which is orangey yellow in color. There was no AV nicking, there was no AV nicking, no hemorrhage, and no lesions noted in the eye. So that is the into the fundoscopic exam. So the next thing that we're going to go on is I'm going to go on to is your ears. Do you have any problems hearing?
Nope.
No. So I'm going to do the whispered test. I'm going to have you cover that ear, and I want you to whisper back. When I whisper something, I want you to repeat it back.
Yeah.
Good. We're going to do the other side.
Baseball.
Good. Whisper test intact. The patient was able to hear whispered words. So that is the cranial nerve 8 acoustic intact. Now I'm going to go on to feeling your tragus. Any pain or any problems with your ears? Looks like there's no sores, no redness, no swelling noted. I'm going to go ahead and do the exam. This is going to look at the tympanic membrane of your ear, so I'll have you hold nice and still for this. I'm going to be using 3-point bracing, looking in the ear. Good. I'm going to come around to the other side. Again, using my 3-point bracing. Good. So I was able to visualize both tympanic membranes, which were pearly gray. There was minimal cerumen, no mucus in the ear. The bony landmarks were visible and the cone of light was visible. All right, so next we're going to go on to your nose. Again, I'm going to be looking in your nose with this light, okay? So go ahead and tilt your head up slightly. I'm going to be using 3-point bracing again, looking in the nose. Good. Going to look on the other side now. Good. So I was able to able to assess the septum, which on both sides, which was midline, no deviation. There was no polyps. The mucosa was pink, and the turbinates were non-boggy. Are you able to smell coffee when it's being brewed?
Yes.
Yes. So that indicates that cranial nerve 1 olfactory is intact. All right, so now we're going to go on to your mouth. Here, I am going to go ahead and have you open your mouth. Good. I'm going to be looking at all the sides of your mouth and under your tongue. Good. So dentition is good. I see no leukoplakia, no rashes, no lesions. No rashes, no lesions, no blocked ducts in the mouth. Okay, now we're going to go on to checking your vagus nerve, which is cranial nerve 10. I'm going to have you open, stick your tongue out, and say "ah" for me. Good. So I was able to visualize the uvula, what was midline, and the soft palate rose and fell symmetrically with phonation, indicating that the vagus nerve 10 is intact. Now I am going to go ahead and have you stick out your tongue and all the way out. Okay, it's midline, no deviation, and then move it from side to side. Good. So that indicates that cranial nerve 12, the hypoglossal, is intact. All right, now I'm going to go on to doing the, I'm going to inspect inside your mouth. I'm not going to do this for the camera because this is my last glove, so I'm just going to pretend that I have my lip glove on. Go ahead and open up. I'm going to be feeling both sides of the mouth, feeling for any sores, indurations, feeling the hard palate, feeling underneath the tongue, looking for any blocked ducts, none noted. Stick out your tongue for me, and I'm just going to be palpating the whole tongue. And then I'm going to go ahead and do the lips as well. So no lesions noted, no lumps, no no problems in the mouth. Okay, so now that we're done with your mouth, I'm going to go ahead and do cranial nerve 5, which is the trigeminal. I'm going to have you go ahead and clench your jaws together. Good. Do that one more time for me. Good. So strong muscle there, 5 out of 5. Go ahead and open and close your jaw. No audible clicking. One more time. No audible clicking. No crepitus noted. Good. So trigeminal nerve 5 is intact. Okay. I forgot to ask you about your tongue. Do you have any problems tasting or any changes in tasting food?
No.
No. So that's cranial nerve 7, which indicates that it's intact for facial, and cranial nerve 9, which is hypoglossal. So all those are intact. Now we're going to go on to feeling your lymph nodes. I'm going to start here at the preauricular, just feeling for any swelling, any nodes greater than 1 centimeter. Going to go to the occipital region, feeling down. Going to go to the tonsillar region, feeling there. Going on to the submandible. Going on to the submental, just feeling for any nodes. Going down to the superficial cervical, deep cervical chain, pushing a little bit deeper because they're harder to feel. Going on to the posterior cervical, and then the supraclavicular, following it all the way out, and then the infraclavicular, following it all the way back in. And no palpable lymph nodes noted. I am also going to do the central axillary node. So here I'm just going to have you rest your arm. I'm going to be pushing up into your armpits and feeling for any nodes there. I don't feel any there. Going to do this side as well. Pushing up, sorry. Okay, good. So no palpable nodes in the central axillary. If there were any in any of those areas, I would feel for ones that are greater than 1 centimeter. If they're soft, firm, swelling, tender, any tenderness when I did any of that palpation. No. All right. So now we're going to go ahead and do some range of motion of your neck. And just follow me. So head all the way down. So flexion is good. You're going to have you extend your neck all the way up to the ceiling. Good. Back to midline. And then I'll have you turn your head side to side. Good. And then ear to shoulder and other ear to shoulder. So full range of motion of the neck. All right. Now I'm going to go ahead and we're going to do another test. Let me grab all my little things here. I need to use my light for this one. Just have a hard time seeing. Okay. Go ahead and take a sip of water. And then take the cup down before you swallow, and go ahead and swallow. Good. Trachea is midline, and it fell symmetrically in a straight line. So, and no swelling noted. So I'm going to have you hold on to that one more time. Now I'm going to go ahead and I'm going to come around to the back. Here I am going to be feeling for your thyroid gland. So I'm going to be placing my hands around your neck. All right? Good. Coming around. Feeling here. Good. Okay, go ahead and take a sip of the water for me. And swallow. Good. All right, I was able to feel that. Okay, I'm just going to be displacing the thyroid on each side, feeling for any nodules. No nodules were noted. The thyroid gland does not appear to be enlarged. Did you have any pain when I palpated there?
No.
All right. Next, we're going to go on and looking at your cervical spine. I'm going to be doing a step-down fashion on my fingers, looking for any drop-offs of your spine, starting at the cervical, working all the way down to the very end. Any pain there? Great. Now I'm going to be palpating the muscles here of the paravertebral, and I'm looking for any pain that you might have. I'm also looking for any if there was any twinging, and none noted there. Did you have any pain? All right, good. So now I'm going to just go ahead and have you take a nice deep breath in and out for me. Good. So the lungs, the chest rose and fell symmetrically. I also need to assess for your AP diameter. And here I want the AP to be half the lateral, which it is. And I'm going to have you lean forward just slightly because the chair is in the way. I'm going to be looking for T10. I'm going to be placing my hands like this. And then I want you to take a really big breath in and out throughout your mouth. Good. So my hands rose and fell symmetrically, indicating good chest expansion. I see no deformities of the chest. The next thing I'm going to do is listen to your lung sounds. I'm going to be moving your shirt out around so that I can hear a little bit better, okay? So first thing that I'm going to do, I'm going to be using my diaphragm for this, and every time I touch you, big deep breath in and out throughout your mouth. If you get lightheaded, just let me know and we can stop. Go ahead. Okay. Again. Yeah. 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 You doing okay? Mm-hmm. And then the last one that I'm going to do is I'm going to listen for the middle. One more time. Right lung, which sounds clear as well. So clear to auscultation throughout. I did not hear any wheezing, crackles, rails, wheezing, bronchi. All right. So now I'm going to go to the front of your chest. Here I'm going to be listening again for lung sound. So again, breathing in and out throughout your mouth for me, big breaths. Good. So again, clear throughout, breath sounds equal bilaterally. I heard no wheezing, bronchi, rails, or crackles. Now I'm going to go ahead and listen to your heart sounds. With this, you're just going to breathe normally. Again, I'm using the bell of my stethoscope, and I'm going to be describing where I'm at. So I'm going to feel down, feel for the second intercostal space on the right, which is the aortic, moving over to the left second intercostal space. Pulmonic, moving down to third intercostal, fourth intercostal. I want to do this under fifth intercostal. And that is the tricuspid valves as well as the right ventricle, moving over to the mid-clavicular fifth intercostal space, listening to the mitral and the left ventricle. Good. So normal S1, S2, no S3, 4 or splitting heard throughout. All right, so now that I've done your lung sounds, I am going to go ahead and inspect your breast. So I'm going to have you place your hands on your hips, kind of poof out your chest a little bit. Here I'm looking for the symmetry, I'm looking for the size, the shape, the contour of your breast. I'm looking for any nipple retractions, any orange peel dimpling, orange peel sign or dimpling. I see none of those. Go ahead and place your arms up over your head. Again, looking for those same symptoms and none noted on the exam here. Now we're going to move over to the couch, and I'm going to do a breast exam with you laying down. All right, so what this, normally I'd be doing this on the skin, but for the purposes of this video and for this exam, I'm just gonna be doing it 2 inches above and with his shirt on. So I will start with my circular motion of my 3-finger pads, starting in the talus fence, working myself, working in a vertical or a horizontal pattern all the way down the breast tissue, making sure not to miss anything. I'm doing light, medium, and deep palpation. I'm gonna go all the way up to the clavicle. And then once I get to the sternal border, I know that I've reached the end of the breast tissue. I also was noting for any nipple drainage, which none was noted here. Now I'm gonna go ahead and have you do this. If I was in a typical exam room, I would go onto the other side to do this, but because the couch, I'm going to be starting in the tail of Spence again, working in a circular vertical pattern, feeling for any lumps, anything like that. Light, medium, deep palpation all throughout, going all the way down and all the way up to the clavicle. Once I get to the nipple, I'm going to make sure there's no nipple drainage. All the way down. Once I get to the sternal border, then I'm completed. My exam is completed. So no breast abnormalities, no lumps, no any pain in anything there that I did. So no pain on palpation, no nipple drainage. The tissue was smooth. All right. Next thing I'm going to do is I'm going to be feeling for your carotids one at a time. So I'm going to be pushing on your neck here. All right, so rated about 72, amplitude at 2 plus. It's a regular. Now I'm going to go on to the other side. Again, rated about 72, 2 plus on amplitude and regular. And here I'm now going to check for breweries of your carotids. This time I'm going to be using the bell of my stethoscope rather than the diaphragm. Go ahead and hold your breath. Good. And no breweries noted. You can breathe. Okay, now I'm going to just go down and listen to your heart sounds again. You can just breathe normally for this. And here I'm going to be doing the second intercostal space again on the right, listening for aortic, second intercostal left, pulmonic, going down to third intercostal, fourth intercostal, fifth intercostal, listening to the tricuspid valve. Here I'm going to go to the fifth mid-clavicular, listening for the mitral. And no murmurs noted. Now I'm going to be checking for the point of maximal impulse. This is mid-clavicular, fifth intercostal space, feeling for that. It's non-displaced and its size is not enlarged. All right, now I am going to go ahead and listen to your aortic vessel as well as your renal and iliac arteries. Good. So that was aortic, going into renal, iliac, and iliac. Good. And there was no bruise noted there. Now I'm going to go ahead and do bowel tones, going back to my diaphragm, listening to all 4 quadrants. Lots of gurgling. So normal active bowel tones with gurgling. Now I want to just go ahead and assess your abdomen. I'm going to be looking here with the light, just looking for any bulges, looking for any scars, striations, looking for any abnormalities of the abdomen, which I do not see. So now I'm going to go ahead and percuss your abdomen. I'm going to do the 9 regions, starting here. So I was able to hear timpani throughout, except I heard some dullness over near the sigmoid colon. So now I'm going to have you bend your knees up a little bit, not to obscure the camera, but all right, so now I'm going to go ahead and do some palpation of your abdomen. Please let me know if anything hurts. I'm going to start with some light palpation, which is about 1 centimeter, watching your face to see if you're having any pain so far, feeling for any masses. Now I'm doing deep palpation, which is about 3 centimeters in, noting no facial grimacing, no rebound tenderness that I noticed. So any pain with the palpation? Good. Go ahead and you can straighten out your legs for me. Oh, you know what I need to do? Before I do anything else, I need to do your liver. So I'm going to feel here using the hooking method. Go ahead and take a deep breath in and out. Good. And no, I was not able to feel the liver borders. I'm gonna go ahead and have a deep breath in and out. Good, and I was not able to palpate the edges of the spleen, which is a normal finding. All right, now I'm gonna go on to your femoral pulses. Feeling here, feeling for rate, rhythm, amplitude, and symmetry. So symmetrical at 72, 2+ out of 4, and regular. Now I'm going to feel for any inguinal hernia or inguinal nodes, and none noted in the inguinal region. Now I'm going to go down. I'm going to be looking at your legs. I'm looking for muscle mass, symmetry, looking at hair distribution. I'm going to palpate down to your quads, to your knees. And then I'm going to be palpating down your shins, pressing in to see if you have any edema. None is noted. Please let me know if anything hurts. Also going to do your calf muscle here. You think no pain there? Kind of feel your toes going all the way down to your toes. So now I'm going to go to the other side, starting at the quadricep again, palpating the knee, looking to see if he's having any pain, going down the shins. Also doing the calf. Okay, and then I'm going to do some pressing for any edema, pitting edema. Going to go down the feet. So no pitting edema noted, no bony abnormalities. Muscles are, muscle mass is good and equal, and no odd hair distribution pattern. Going on to your toes, I'm going to go ahead and feel for your dorsal pedalis pulse. Okay, rate is about 72, amplitude 2+ out of 4, regular and symmetrical. Now I want to do some range of motion exercises. I'm going to have you pull your toes back towards your face. That's dorsal flexion. Then I'm going to have you point your toes towards the camera. That is that's plantar flexion. And I'm going to have you put your toes together, eversion, and then I'm going to have you put your soles of your feet together and all the way up, inversion. So good. So full range of motion of the ankles. Now we're going to do some range of motion of the hips, and I'm going to be doing the work here for this. Okay, so try to relax. First thing I'm going to do is I'm going to do some flexion, and then some extension, and then I'm just let me do some abduction, and I'm going to do some external rotation and then internal rotation, and good. Now we're going to go on. Did anything hurt there? Nope. Next, and I'm going to go on to some flexion, extension. I'm going to go on to abduction, and then external rotation and internal rotation, which full range of motion of the hips. Now I'm going to go ahead and have you sit up for me, Brooks. Okay, here we're going to do a cerebellar testing, and with this, we're going to do the rapid alternating movement. I'm going to have you place your hands on your thighs and then the back of your hands, and then do that and just get faster and faster. Good. So good rate and rhythm. So neurocerebellar function. Now I am going to go ahead and I'm going to do your reflexes. First, I'm going to start with the bicep. Good. 2+. So then I'm going to do the radial brachialis, 2+ there. Going to go to the tricep. Good, 2+ there. Going on to the bicep, 2+, not 3+, maybe even. And brachial radialis. Good, that was about a 1+. Going to go here to the tricep, 2+ on that. All right, and now I'm going to go down to the patellar reflex, 2+, 2+ on that side. Going on to the Achilles, 2+. Good, 2+. So all of the deep tendon reflexes intact. All right. Now I'm going to go ahead and have you stand up for me. We're going to be looking at your spine. I'm going to have you face your back to the camera. Okay, good. So face back to the camera. So here I'm going to be looking at the curvature. I want to have concave of both the cervical and the lumbar and convex for the thoracic. I see no lordosis, no kyphosis. I'm going to have you bend over for flexion, have your hands dangled down at your feet, looking at the spine, no scoliosis noted. Going to have you stand up for me. Go ahead and extend all the way back. Good, so good extension. So full range of motion there. Now I'm going to go ahead and have you turn around, face the camera. We're going to do leg strength. Have you stand on one leg and then bend down. Good, so full strength there. Let's do the other leg, same thing. Good, full strength there as well. Now we're going to do the walking test. I'm going to have you just walk up about 10 steps. I'm going to be watching your gait, looking at the arm swing. Good, come on back. Arm swing is good. No shuffling, no wide stepping. Wide step. I'm going to go ahead and have you walk on your toes just a little ways up. Good gait, good balance. No shuffling, come on back. On your heels. Good, again, good strength, good balance. And then we're going to do what's called the tandem walking, which is like this, heel, toe. Just need about 5 steps of that to make sure that you have good balance. So good balance on all those tests, as well as there was no leg lag, there was no wide stepping, and no shuffling. All right, so that is the end of the test for you. Now I'm going to go on to the, I'm going to bring it up to you. The general urinary exam. So first I'm going to do the male. With him, I'm going to have him talk to him about what I'm doing, get consent. I'm going to be washing my hands, placing my gloves. I'm going to be sitting, he's going to be standing in front of me. First, I'm going to be looking at the pubis area, looking for any abnormalities as far as rashes, infestations, looking for hair distribution pattern. I'm going to go down to the penis, looking at the skin. I'm going to palpate down the penis to the glands. I'm going to have him retract if he's not circumcised, the foreskin, and then I will be looking at the urethral meatus, looking for any lesions, looking for any drainage. Once I'm completed with that, then I will go on to the testicles. I'll be doing them one at a time, so I'm just going to explain it for one side, but with the intent that I'm doing both. So I am going to take the testicle between my fingers. I'm going to be feeling just for any lumps, seeing if there's any pain, any redness, swelling, tenderness, going up to the epididymis, feeling the epididymis, up to the spermatic cord, feeling and I'm following the spermatic cord all the way up till the inguinal ring. At the inguinal ring, I'm going to insert my finger. I'm going to have him turn his head and cough. I'm feeling for bulges. If there's no bulges, then he does not have a hernia. So I would do the same exact procedure on the other side. Once that is complete, I would go ahead and we're going to do a rectal exam. So getting his permission, I would have him bend over the table. I would be standing. I would lubricate my index finger. I would ask him to bear down. I would be inspecting his anus for any hemorrhoids or any fissures. I would then, again, having him bear down, insert my finger into his rectum, feeling for sphincter tone, rotating all the way around, lateral, anterior, posterior, and both lateral sides. Looking for or feeling for any lesions, nodules, hemorrhoids, anything like that. And then I would feel the anterior surface for his prostate. Here I'm going to be feeling the sulcus. I'm going to be feeling for the two sides of each of the lobes of the prostate, noting any tenderness that should not be tender. Also feeling for the size, it should be about 1 centimeter protrusion. There should be no masses, so feeling for masses. Also just feeling the texture of the prostate. Once that's done, I'm going to remove my fingers and give him a tissue. So the next part will be the female exam. With the female exam, I'll be washing my hands, placing gloves on. I'll have her in the lithotomy position, draping her so that so that I can see her face. First, I'll be inspecting her mons pubis, looking at hair distribution pattern, looking at the Tanner scale if she's young, also looking to see if there is any infestations, rashes, none noted. From there, I'll be inspecting the labia major, labia minora, the clitoris, the urethra, the interosseous, and the rectal area for any hemorrhoids. Once that is complete, then I'll be taking my speculum that's soaking in warm water. I'll put a light lubrication on it. I'll be inserting my finger into the posterior area of her vagina, letting her know before I do this that I'm going to be doing that and that I'm going to be touching her. And then I'm going to take the speculum at 45-degree angle in a slight downward motion. I'm going to be inserting it all the way in. Once I'm all the way in, I'm going to rotate it horizontally and slightly open it to see if I can see the os and the cervix. If I cannot, then I'm going to slightly pull back a little bit. And then go upward with the speculum, again opening. Once I see the cervix, I'll be inspecting the cervix and the vagina for the walls of the vagina for any bleeding, any lesions, any redness, any discolorations. Once that is complete, then I will pull the speculum back just slightly past the cervix, closing it with a downward pressure. I'll be pulling it out. Then I'll be instructing the patient that I will be doing a bimanual exam. I'll be taking off my left glove, lubricating my index and middle finger. I will then insert it into her vagina, feeling for any lumps or lesions. Then I'll be feeling her cervix for any cervical motion tenderness, just pushing it around a little bit, watching her face to see if she grimaces. Feeling the walls for any palpable lumps or any sores. Then I'm going to be inspecting the size of her uterus by taking my non-dominant hand and pushing down her uterus towards my fingers, feeling the size and the shape, and seeing if the uterus is fixed or if it's soft and able to be moved. Then I'm going to go on to the adnexae, pointing my fingers that are still in her vagina towards the right. I'll be capturing the adnexae by using a swooping motion with my hand. Once I capture it, she may have a slight twinge. I'll be feeling for the size, the shape. It should be about the size and shape of an almond. It should be movable. There should be no lumps. Then I'm going to go on to the other side, alternating my fingers to the other side, swooping, capturing the adnexae again, and then just feeling size, shape, seeing if it's movable or if it's fixed or if there's any lumps. And that's the end of my exam.